Do you consent to this video?
Yes.
Okay. Okay. Hi, my name is Caitlin, and can you tell me your name and date of birth?
Kylie Jensen, A2902.
Okay, so today we're going to be doing a head-to-toe assessment. At this point, I would wash my hands and provide privacy. Okay, so looking at my patient's positioning, she is upright and erect, and she is well-dressed and well-nourished, it appears to be, and she is also clean. And looking at her facial expression and her mood, they correlate. She appears to be content, and she's making good eye contact. And can you tell me your name again?
Kylie Jensen.
Can you tell me around what time it is?
10.
Can you tell me where you're at?
My room.
Can you tell me who the president is?
Joe Biden.
Okay, so she is awake and alert and oriented ×4, and her speech is clear and articulate. And if you had any pain, can you put it on a scale of 0 to 10, 0 being no pain, 10 being the worst in your life?
0.
Okay, so now I'm going to assess her pulse. Oops. Okay, so it is regular, elastic, and about a +2, so I'm going to count for 30 seconds. Okay, I got about 72 beats per minute, which falls within the normal range of 60 to 100. And while I was doing that, I was looking at her breathing, and it was at about at a depth of 1 inch and appeared to be unlabored and regular, so that's normal. And I'm going to now count for 30 seconds, and you can just breathe normally. Okay, I got 16 breaths per minute, which falls within the normal range of 12 to 20. So now I'm going to do her blood pressure, and I've already measured it to be 40% of the width of her arm and 80% of the bladder. And do you have any reason why I shouldn't be taking blood pressure on this arm?
No.
Okay, let me make it tighter. Okay. All right. You can put your palm up. Okay, and just relax it. Okay, I got 115/70, which is normal because the systolic normal ranges are from 90 to 120 and diastolic from 60 to 80. So now I'm going to just start with the head-to-toe assessment, starting with her head. Her head is proportionate and erect, and her eyes, nose, and ears are all symmetric. Can you puff out your cheeks? Can you smile? Okay, so her face is symmetric with movement, and now I'm going to assess her eyes. Her pupils are round, and they are about 6 millimeters on each side. And now I'm gonna test the reactiveness to light first directly, so you can look straight ahead. Okay, so they both constricted, which is normal, and I'm gonna test them indirectly. Okay, they also constricted, which is again normal. You can focus on the tip of this pen light. Okay, her eyes converged and her pupils constricted, which is again normal. Okay, so now I'm gonna look at her arms and hands and fingers. So they are beige white with pink undertones, and they are symmetric and equal in size and shape. And the only lesions I note are primary lesions in the form of freckles, and there are many of them. They are scattered, pinpoint on the anterior surface of her arms, and they are circular. So now I'm gonna palpate. Okay, so I did not note any edema. And right now I'm checking temperature. I don't know any moisture, and her arms were warm throughout. Did you have any pain or tenderness when I was palpating?
No.
Okay. So now I'm gonna go on to listen to her lung sounds. So first, looking at her chest, the sternum is midline, and the ribs slope down at a 45-degree angle. And I'm going to go ahead and listen. Okay, can you move them a little bit? On the other side. Okay, you can go ahead and turn around. Her lung sounds were clear bilaterally, which is normal. So now I'm going to go ahead and do the same on the posterior side. Okay, you can turn back around. So again, they were clear bilaterally, which is normal. So now I'm going to listen to her heart sounds, and I'm going to do it in this order: aortic, pulmonic, Erb's point, tricuspid, and mitral. Then can you pull it up a little bit? Okay. So, her heart sounds were regular, strong. I didn't note any murmurs. I heard S1 loudest in the mitral area and S2 in the aortic and pulmonic. Okay, so now I'm gonna assess her abdomen. So you can go ahead and lay down. Oh my goodness. Okay, I think that should be good. Okay, so you don't need to stick up or anything. You can just. Okay. Okay, so looking at her abdomen, it is symmetric and flat and non-distended, and the only lesions I note are primary lesions, 2 of them. One is about the size of an eraser head and one is pinpoint. They are both in the right upper quadrant, and they are freckles and circular, and they are a little bit scattered from each other. And then I also note a secondary lesion in the form of a umbilicus piercing, and I do not see any redness or exudate or drainage from this or the umbilicus. And the umbilicus is also midline. Okay, so I'm going to go ahead and auscultate. Do you have any pain before I begin?
No.
Okay, so I'm going to start in the right lower quadrant, but if she did have pain, I would end in the place where she had the pain. Okay, I heard soft clicks and gurgles about 8 times per minute, and this falls within the expected range of 5 to 30. And so now I'm going to go ahead and palpate in the same sequence. And I do not note any rigidity or guarding. It was soft. Okay, you can sit back up. So now I'm going to inspect her legs and feet. And could you scoot back a little bit? Okay. So, looking at her legs, they are symmetric and equal in size and shape. And I'm gonna look all around. And the only lesions I see, I only see one lesion in the form of a mole on her left upper thigh, and it is about the size of an eraser head, and it is circular. And now I'm going to palpate. So I do not note any moisture, and there was no edema. Do you have any pain or tenderness when I did that?
No.
Okay. And it is also warm throughout. And I'm gonna look in between her toes. And I also looked underneath on her heels, and I did not see any decubitus, which is good. And now I'm going to palpate her pulses. So first I'm going to do the posterior tibial. Okay, so those were elastic and about a +2 and regular. So I'm going to do dorsalis pedis. And those were also regular +2 and elastic. And do you have any numbness or tingling in your extremities?
No.
Okay. So, I think that completes the head to toe assessment. I would also assess for any IV, Foley, or oxygen source she may have had. Then I would put her back into a comfortable position with the bed in the lowest position, side rails up ×2, call light and personal items in reach, and then I document my findings.